The 24-hour curfew remains in effect until 5 a.m. tomorrow, Tuesday. Meantime, the public is asked to stay at home. Hello and welcome to the live broadcast from the Information Command Center at the GIS studios. This is the response, the national response to COVID-19. My name is Jessie Leonce. Thank you so much for joining. To begin, I want to go over some important updates. The island registers its 14th COVID-19 diagnosis over the weekend. Another batch of persons are discharged, also all cleared of the coronavirus. Victoria commences operation as a respiratory hospital today, Monday, and the ongoing 24-hour curfew will be replaced by a 10-hour curfew this week, starting tomorrow, Tuesday. These are the developments that we will be delving into this morning, especially the last in terms of the services being offered and guidelines for this reduced curfew. The national shutdown will end one day before initial schedule. In an update to the nation last night, Prime Minister, the Honorable Alan Chasney, indicated that a review to the curfew was in part contingent on the outcome of the most recent test results, which came back with one positive COVID-19 case. We start off the broadcast engaging Dr. Sharon Belmar-George, the island's Chief Medical Officer, who is on the phone right now. Good morning, Dr. Belmar-George. Thank you for this call-in.
Good morning to all.
Thank you. Hope you are well despite the circumstances.
Yes, I'm doing okay, thanks.
Thank you. We went from registering 5 and 4 confirmed cases at a time the week before last to now 1 in this instance. How does the Ministry of Health interpret this past week's figures, and what comfort was given to Cabinet enough to reduce this curfew?
So far, St. Lucia has registered 14 confirmed cases of COVID-19 to date. Over the last month or so, we've seen the rise of those cases. When we noted we had at least 5 in-country transmission cases, it indicated a more aggressive approach towards a more aggressive public health effort was needed to reduce the impact within some of the communities. So the national shutdown, that is a 24-hour curfew, was absolutely necessary. And I would like to indicate that the longer the period of this 24-hour curfew, the more effective it is, because it means it reduces the direct person-to-person contact. For every confirmed case that we get, the level of contact tracing that we have to do is intensive. And if you think of yourself, your activities during the normal day, if you go to the gym, if you go to work, if you go to the supermarket, you go to a shop, whoever you see and whoever you speak to becomes a contact. So the potential of spreading COVID-19 based on its level of ineffectiveness is quite easy. So by keeping everyone at home in quarantine, it reduces the number of physical contacts that you have and halting the disease in its track. So it was an extremely important venture last week. I know for some people it was difficult, but it was absolutely necessary. The partial opening that we are doing is only to facilitate persons getting their basic requirements. As much as last week we were encouraged by our tests, the tests we received during the week were negative, except for one which we received on Saturday morning. That was one extra. Saturday morning? Yes, one extra case we received last week, and we are also quite pleased not to have any complicated cases or any deaths to date. But we must not use this as a false sense of security. And I do not want the public to interpret the partial opening, that is putting the curfew up to 10 hours, to think that it is all okay. It is not all okay. We need to encourage the public that although there is a partial opening, it is only to encourage for persons to get their basic requirements. And the Office of the Prime Minister will explain later the zoning, because we want persons to stay in their region, in their area. Wherever you live, shop in the supermarket closest to you. We want to reduce the physical interaction between people as much as possible. So we want, if you need food, you need water, you need gas, you need to go to the bank, you do it, but you have to observe the guidelines of physical distancing. If you go into the supermarket, it's not the time to stop and chat in a group outside the supermarket. You maintain the 6 feet distance between you and everybody else. We need to treat COVID-19 and everybody that we know as if they have it, and we are protecting ourselves from getting it. So as indicated last night, the curfew was reduced from 10 hours to a 10-hour curfew from 7 p.m. to 5 a.m. And it will be the services which were under SI 44, which will be further explained during the day of today. So the services will operate from Tuesday onwards, so just to facilitate that the population can get their basic requirements. We continue to encourage that everyone stays at home. Also, we do not want more than 2 people in a vehicle at any time, and the police will be monitoring and enforcing the zoning for us. The police will also be patrolling the supermarkets when they are reopened on Tuesday to ensure compliance of the COVID-19 social distancing health protocols. And the sale of alcohol is still prohibited because we want to ensure that our bars remain closed, and we want to discourage the parties and the get-togethers that we noted was still happening. So for today, the supermarkets will be open just to facilitate restocking. Of importance, we want to indicate today, as indicated last night, that only the bakers will be open for delivery services, and other sectors like the supermarkets, mini-marts, and distributors is only for restocking. The minibuses only for essential services during this time. And we are really hoping, because we need the public to work with us. We continue to say to stay at home, leave only for essential purposes such as medical emergencies. We have shared our clinical medical cell numbers, which are free of charge for the public to call. If you have any health concerns and you want to speak to a medical practitioner, you could call. We have shared the list of cell numbers. I would appreciate if you would also share those numbers with the public as well, so they can get clinical advice for any concerns. Our respiratory hospitals remain open. That is the Grosselet Polyclinic, the Leclerc Wellness Center, the Dennery Hospital, the Soufre Hospital, the Viewfort Wellness Center, also the Victoria Hospital has a respiratory clinic, and the St. Jude Hospital. We also shared the list of pharmacies that are open. So communities and persons who need to seek medical care, we have a list of facilities that are open, including our respiratory clinic. We also shared the pharmacies that are also open at this time to ensure that medical care is provided. The 311 hotline is also available for general information if anyone wants to know on COVID-19. So we remain available to ensure that the public has access to health care during this time. But for any other reason, we would like for persons to stay at home. Avoid masquerade events and social gatherings. And if you have to go out, ensure you practice social distancing. I also want to appeal to the public, those of us with elderly parents, grandparents, grandaunts, aunts. Let us protect them. If you have an elderly relative or anyone with a weak immune system, encourage them to stay home by providing support. Call and find out, do they need their gas? Do they need food? Do they need water? Go and get those items and drop it at their doorstep. Don't go in to mingle with them if you are out, because you want to keep them protected. But however you can go out and get whatever items that they need at this time, plan for them so they do not see the need to go out. We need as much as possible to protect our vulnerable groups. Every single life is important to us. So if you have an elderly relative who needs assistance, please go out and provide that assistance so they do not need to go out. We also encourage the practice of good personal hygiene. We have been saying every single day about washing your hands and washing them frequently and properly. Avoid touching your face, your eyes, your nose, your mouth, to cover your cough and your sneeze as well. And we are also asking people to ensure they adhere to the curfew which is in effect. Each and every one of us, we need to play our part. We have our healthcare workers who have put their lives and the lives of their family at risk taking care of patients within the respiratory clinics and at the respiratory hospital. We also have a responsibility of reducing that impact to them. So let us do the right thing. If we don't do it for us, let us do it for the vulnerable groups within the population.
Thank you for that. How has the contact tracing efforts been going so far? I understand that this latest case of COVID-19 in St. Lucia was as a result of contact tracing?
Yes, we have identified many possible suspect cases from our contact tracing. That is, we go back to everybody that one person would have been in contact with during the period of infectiveness. And what we do, we have been doing testing for those persons in an effort to reduce their contacts. It has been going well. Our teams have been working on the ground and in communities. There are certain communities that seem to be more at risk, so we have been putting a lot more effort into those communities. But it's an effective way to assist in the containment of COVID-19. As you could imagine, St. Lucia is small, and the movement from one district to another is quite rapid, as a lot of people don't work in the areas that they live. So to reduce, that is why the stay at home is important. The least persons that you come into contact with, the lower your chances of getting COVID-19.
Another batch released from quarantine over the weekend. Can you give us the status of the quarantine facilities at the moment?
As of this morning, we have a total of 34 persons at the Rodney Bay Public Health Facility. We have discharged those who were at the Castries Public Health Facility. So today we're admitting contacts of contacts or suspect cases coming from our respiratory clinic. So we encourage those who need to go to your healthcare practitioner, or if after you've called our medical clinical line, if you have moderate or severe disease or you are at risk, we encourage persons to go into those respiratory clinics, and persons from there, if needed and need to be isolated, we also keep while we await test results.
You've already mentioned that the country will be entering a reduced curfew starting tomorrow. Just for our viewers just joining in, that's starting tomorrow, Tuesday through to Saturday, except Good Friday. So from 5 a.m. to 7 p.m., members of the public will have the opportunity to go to supermarkets and other essential retail outlets. I don't want to keep you too long, Madam CMO, but before you wrap up, could you re-emphasize the shopping distance measures and just overall physical distancing protocols as outlined in the emergency powers order to remind the public as they proceed, they head out tomorrow?
Okay, the supermarkets, the food suppliers, and the retailers have been working closely with the Ministry of Health to ensure adequate measures are in place to facilitate their reopening on Tuesday, April 7th. And all of this is done to reduce the spread of COVID-19, as we understand that the population needs to get food. However, we want to ensure that the number of customers inside of the store is limited to ensure adequate physical distancing. Every customer coming in, we are asking that they wear a face mask and sanitize hands. The supermarket, their workers also need to be protected. They are coming out to serve the public, and they will be in touch with everybody that they are serving during checkout and that they are assisting in the supermarket. We have the responsibility to protect them as well. So we, the public, have to reduce our interaction and ensure we keep a safe distance from them as well. They've also indicated that they will manage the queuing of customers outside of the store to ensure safe physical distancing, no less than 6 feet. Their internal controls will avoid hoarding of items because we know people tend to panic buy. Also, their systems and resources to move the customers in an efficient manner, and also to work with the local community stores to ensure adequate supply of goods so persons who live in communities can access those. Since we want to limit as much as possible the movement from one zone to the other, we need to ensure that those small shops are also supplied to provide for the smaller communities. The distributors and retailers are also encouraged to facilitate online and direct delivery to providers and to shoppers, and also stricter protocols governing the use of transport carrying supermarket and essential service workers. They've agreed to increase the intensity of cleaning protocols, and also we are doing a review to limit the sale of certain on-site prepared foods to reduce any possible impact.
Okay, Madam CMO, we are joined in studio by Carlton Cyril, better known as Cokes, and I hope you don't mind, he will engage you in Creole just for some of the viewers who prefer hearing Creole this morning. Carlton?
Okay. Bon, moi dis bonjour et merci pour parler avec nous. C'est bon, moi dis Dr. Belmar-George. Bonjour. Hello?
Okay. We're not hearing from her, but perhaps we've lost the call. Okay. Okay.
Okay.
Okay. Yeah, we might. It appears we've lost the call from. No. Is she on the line? No. Okay, it appears we've lost the call from Dr. Sharon Belmar-George, the Chief Medical Officer. They're giving us an update as of today, Monday, on the the confirmed case. That was one new COVID-19 case, bringing our total number of cases in St. Lucia to 14. I just want to read out the press release that was issued from the Ministry of Health, just a part of it. On Saturday, 4th April 2020, St. Lucia recorded one confirmed case of COVID-19. The individual is a 56-year-old female who is the contact of one of our previous confirmed cases. She was brought in for testing through the contact tracing team. This confirmed case brings the national total number of confirmed cases of COVID-19 recorded to 14 to date. The individual is currently in isolation for the management of her case, and she is in good spirits. All cases currently in isolation are responding well to their treatment and continue to do well to date. None of the confirmed cases have complicated or required respiratory support, nor have any cases progressed to death. St. Lucia has 0 deaths of COVID-19. As mentioned earlier, we are joined in studio by Carlton Cyril, also known as Cokes, who will just provide a synopsis of the Madam CMO's words this morning.
Ok, merci Anjay, Jesse. Là, il vient pour bon matin, nous allons dire merci encore pour vous qui écoutez nous à ce GISNTN et puis pour n'importe radio station qui écoutez nous à ce. Information nous ici à sous COVID-19 qui a continué, nous avons information qu'on nous joigne que nous avons ou payer attention pour ces avertissements et informations nous avons ici. Au cas savent nous tenir sous téléphone et puis nous chef médical officier pour cette liste ça c'est Dr. Belmar-George. Là yo souhait sous écouter il vient répéter en chay ça il était jadia en parmi et ça il mentionnait c'est il nous ka fait moun savent les venir pour payer fermé toujours. C'est moun yo ka permettre pour sorte de conduire business ça kay ces gens bakery encore nous ka dit ces gens bakery ou supposé délivrer et ben ay vendre pain mais moun pas supposé vinn en bakery raison pour ça c'est parce que yo pas vle moun assembler ou kay bien savent ou supposé être 6 pieds yon à l'autre quand commission bien claire. En parmi l'autre monde, si moi mentionné qui ça doit là, c'est un chay c'est moun qui a distribué marchandises et puis bien bay supermarket, bay ces petits mini matlan, moun qui besoin gaz ni pour tuit manger puis pour en machine ça c'est moun qui ouais doit aujourd'hui pays a poko ouvert totalement yon ni kay ban soulagement mais soulagement ça kay vini demain yon c'est bagay là si moi fait mentionner qui bien important c'est date qui yo ka permettre nous pour aller dehors et puis ça c'est demain mardi mercredi jeudi mais yon c'est bagay là qui bien important c'est date qui moun changer c'est nécessité seulement kay besoin yo vlo acheter yo pas kan permettre moun ay dehors pour acheter toute bagay puis pour nan bon temps ou supposé vier repleni glow manger bagay ou kay besoin là même pour là même parce que nous poko fini et ben yo poko hen remède pour COVID-19 quand là si moi dit l'autre bagay qui bien important c'est si on est grand moun si on est moun qui malade moun qui jani en maladie moun qui ni maladie respiration pawon grand moun c'est moun ça souple yo ka mando si ou ça prend casser moun ça ve ça yo brisé kouye yo ek l'eau aller là ça prend chance pour aller embrasser yo ba yo beau aller ça non mener ça ou ka mener ba yo et quitter bon la porte là di un petit bonjour avec parti parce que c'est moun ça plus vulnérable et c'est moun ça si yo jani disease là si yo ja malade covid vermine covid là pas kay fait bagay pli mais ba yo encore là vini pour ces places là qui kay ouvert yo ka dou 6 pieds ou supposé ou était hod yon à l'autre mais c'est ça là bien important pour nous pe comprendre ou supposé ou était 6 pieds hod yon à l'autre en chay moun moi passé bon matin avec moi en chay moun ka combler ensemble ka vini comme si di we rien pas rien nous en dans ka di soukou toujours nous un petit soulagement mais ça pas veut dire ou on que ça aller avec venir ensemble avec parler qu'on voulait souple wete hod yon a lot ou ka tan mot parole social distancing ça veut dire wete hod yon a lot et 6 pieds quoi possible là yo hamade date qui nous fait ça là vini pour ces gens minibus là il ka continuer quand l'habitude Jean minibus qui supposé d'or et ben minibus qui supposé d'or c'est ça qui j'ai approuvé c'est ça qui a chaillé ces gens service essentiel qu'on a trouvé qu'on informé là vini pour ça encore nous tant si moi ka mande moun souni gwan moun oliwon ou qui ka pomnek duve tout partout trouver qu'on informé ou ça mène vers maintenant bay un gwan moun qui la kay li qui pa ka aller pièce côté quand là ou même kakachile c'est où yon ben ça pas ka faire rien et bon jeune là ni gwan moun maman ou papa ou gwan maman c'est moun ça yo acide la kayo et puis ou qui ka duve tout partout et pas mêler puis rien ou ça mène vers maintenant bayo quoi messieurs oreilles pas ka ho passer tête encore message là bien clair en conversation qui tenait puis si moi bien vite encore Mazel Léonce mandé lay vini pour ka contacter et pour yo redécouvrir côté c'est moun qui ni vers maintenant déjà passé ben moun yo te en contacter puis si moi docteur Belmar-George dit ça ka aller très bien effective as a résultat de ça nouvelle nous ni moun ça là yon un jeune femme de l'âge de 56 ans c'était 14e moun et puis manière yo joindre c'est yon moun qui te janing après yo vie revisiter tout partout y passer avec moun qui en contacté puis moun ça après yo tester yo trouver date qui c'est yon moun qui ka mouche sin vers maintenant ça qui bien bon pour ça c'est yo jamais été en isolation yo ni là yo ka observer mais il pas ka fait trop mal il ka répondre bien et puis tout bagaille OK puis pour à présent quoi il ka prend traitement avec bagaille pas mauvais nous voulons dire la pokoni personne qui mort les vini pour 20 minutes ici à Saint-Lucie et pour date nous ni 14 moun qui a trouvé koyo affecté et qui a pris traitement et traitement yo ka prend il ka aller et puis yo pour à présent et la pani personne yo ni qui a sous machine pour aider yo prendre l'expiration quoi bagay là ka marcher pour date tout ka ils savent aussi yo ja quitté 85 moun ja allé la kayo ça c'est moun yo tenir facilité pour quarantine yo quitté ces moun ça aller vendredi les vini la tenant l'autre compagnie et yo quitté aller samedi 13 en l'autre 13 7 moun c'est moun ça trouvé quoi yo quitté yo aller kayo parce que yo pas tenir sin mais qu'on l'habitude yo ka prend précaution parmi ba bien important si mot parler dit c'est là où il y a une chance pour nous de sortir dehors, messieurs, dames, s'il vous plaît. Encore, nous avons plaidé, nous avons dit ici, là où il va en ces places-là, supermarket, minimat, n'importe ce côté, où il y a trouvé quoi, bagay qui bien important si moi parler avec nous, mentionner, yo souhait, avec nous, vieux dit bon matin encore. Police qui doit pour combien de monde qui ka sort d'oreille ben qui ka dans yon machine yo ka permettre deux moun pour dans machine deux moun par famille ben trouver qu'on informer avec la kayni police ka fait assurer ou suivre ces directions ça parmi l'autre bagay yo ka mandé place business fait assurer on y ligne et ben on en côté ben on en moun ka fait moun changer aussi supposé être 6 pieds hod yon a l'autre sous quand toi c'est place ça yo ka mandé date que vous mettez masse en fidjayo et pas oublier laver la main sanitize la main sur ni pour mais était 6 pieds et changer pour mettre massou là kay dowa là vitement si moi aussi dit premier ministre là kay parler à sous ça yo qui zoning qui veut dire kay ni pour être en communauté ou sortir pour faire business et ou supposé ni ID cadeau police qui fait assurer on y ID cadeau pour trouver côté ou kaya pays a été fermé encore c'est gens qui travaillent service essentiel yo qui supposé doit et puis c'est Jean Bakery et c'est moun qui a distribué marchandises parce qu'on kay savent les moun qui sortent dehors pour yo manger boire la supposé ni assez bagay pour moun boire en tout nous ka quoi ou ka été écouter puis nous qu'on nous continue ici à ba information qu'on nous joigne ici à sur GIS et puis n'importe station radio ou ka écouter nous à sous merci en chay tellement Mademoiselle Jessie.
Thank you. Thank you, Carlton. And also to Madam CMO, the Chief Medical Officer, Dr. Sharon Belmar-George. We'd like to thank you so much for your time. We imagine how much of a busy time it must be for you. Viewers, the island's Chief Medical Officer, Dr. Sharon Belmar-George, on the line with us this morning. We'd like to thank her so much for that quick phone call. Today, Monday, 6th April, the general public is asked to remain home. Remain home today. Today is the last day of the 24-hour curfew, the national shutdown. Bakeries can make deliveries, supermarkets, food suppliers, other retailers like mini-marts and community small shops and gas stations are busy restocking today, preparing for tomorrow when the nation reopens at 5 a.m. under a reduced curfew. Between 5 a.m. and 7 p.m. on Tuesday, Wednesday, Thursday, and Saturday this week, the country will reopen on a scaled-down basis, with just essential service entities being open. And from 7 p.m. on evenings to 5 a.m. this week, a 10-hour curfew will be in effect. We have a clip from the Prime Minister now outlining conditions for this new curfew. He gave an update to the nation last night, and we just have that quick insert from last night.
While we're in that 10-hour curfew, the public are encouraged that customers will only be 2 per family to shop within their own communities. The country will be zoned, and we will provide greater detail tomorrow on where those zones are and what you're expected to do to remain in your zone. Only 2 people will be allowed to be in a private vehicle at any one time. I would like to say to you that the police will be monitoring and enforcing the zoning. And one of the things that they'll be using is they'll be using road checks and checking your driver's license to ensure that you're remaining in the zone that you are residing in. The police will be patrolling when supermarkets are reopened to ensure compliance of the COVID-19 and the social distancing health protocols. So again, the police will be working with the business community to make sure that there will be strict enforcement of these protocols. And again, tomorrow, we're expecting that the business houses, the banks, and the supermarkets that will be opening up will be putting marks on the sidewalks and also internally systems in order to make sure that the social distancing is going to be enforced strictly. We're also going to continue to prohibit the sale of alcohol everywhere, including at the supermarkets, the grocery stores, and at the gas stations.
From Dr. Sharon Belmar-George, the Chief Medical Officer, speaking last night on the listed shopping measures for retailers. So as you go out tomorrow, we want you to be very careful with how you engage other persons, and the retailers have been charged with certain responsibilities to ensure that their patrons adhere to the rules and regulations of the Emergency Powers Act.
Some of the shopping measures include, and are not limited to those, limit the number of customers inside the store to ensure adequate social distancing. Ensure every customer entering the store has a face mask and sanitize hands. Manage the queuing of customers outside of the store to ensure safe distancing, no less than 6 feet. They will have internal controls to avoid hoarding of items. Ensure adequate systems and resources to move customers in an efficient manner. Distributors will work closely with local community stores island-wide to ensure adequate supply of goods. Distributors and retailers to encourage and facilitate online and direct delivery providers and shoppers. The enforcement of stricter protocols governing the use of transport carrying supermarket and essential services. The increased intensity of cleaning protocols for retailers. Also, to limit the sale of chilled, on-site prepared, chilled ready-to-eat products such as cut fruits and salads.
National protocols for the curfew will be maintained as the overarching protocols for persons going out this week. We're going to take a look at the third clip.
We continue to advise the public to stay at home. Only leave for essential purposes, such as medical emergencies. Avoid mass crowd events and social gatherings. Although we've opened up a bit, mass gatherings are still banned. Practice social or physical distancing, that is, remain 6 feet from the closest person. Practice good hygiene, such as frequent hand washing. Avoid touching your eyes, your nose, your mouth. Cover your cough and sneeze with tissue. Wear a face mask or scarf when going in public areas. Adhere to the curfew in effect.
The Chief Medical Officer there, Dr. Sharon Belmar-George, on the maintenance of national protocols when the curfew is reduced to 10 hours this coming week. Resumption of waste collection services. The St. Lucia Solid Waste Management Authority wishes to advise the general public that effective Monday, 6 April 2020, waste collection services throughout the island will be provided on a limited basis. The adjustments to the service will be as follows. There will be no collection of bulky waste items until further notice. Regular waste collection will only be undertaken on the first scheduled collection day of each week. This is to say, persons who normally receive their collection on Mondays, Tuesdays, or Wednesdays as the first collection day of the week will only receive collection on that day. Residents of Mon-Lacroix, Labrie, Park Estate, and Salterbus will receive waste collection on Tuesdays. This schedule will remain in effect until the St. Lucia Solid Waste Management Authority informs otherwise. Your cooperation is greatly appreciated at this time. I now pass on to Carlton to give a synopsis in Creole of the last few clips that we've heard and of this St. Lucia Solid Waste Management Authority notice.
Encore merci Jesse. Là il vient pour information nous ka about like ça ou peut-être kay hatten encore ou kay savent pays a fermé toujours. Ça qui kay fait demain mardi, mercredi et jeudi ou kay hen permission pour aller faire affaires là pour amasser bagay ou bien brisé mais information et avertissement là toujours nous ka dou ça pas vle di ou ça fait ça ou vle commencer demain aller mercredi et puis jeudi là curfew a nous ten bay là kay aller pour 10 heures de temps qui vle di depuis 7 heures au soir pour 5 heures bon matin ou trouver corps en dedans encore n'a vie répéter à sous ces jours ça mardi, mercredi, jeudi et samedi, là où il y a une permission pour dormir là, ou supposé vier trouver corps en dedans, depuis 7 heures au soir, et bien, 7 heures au soir, excusez-moi, pour 5 heures bon matin. Là, ou qu'il permet, ou qu'il y a une permission pour aller joindre ces marchandises là, ces commissions brisées, gaz ou pour tout manger et puis pour mettre en machine. Mais, nous avons changer. Des moun pas famille en dedans yon machine, des moun pas famille expressement communauté plus tard nous kay tan hod premier ministre là là vini pour affaire zone à présent yo kay permis pour rester en communauté dans zone yo kay diviser pays en différentes zones information ça nous kay henne hod premier ministre là police kay patrôler pour faire assurer moun coûter ça qui dit et moun ka payer attention pour lui. Là il vient pour ces gens business qui bien important ou kay vietan là il vient pour CMO dit that qui yo kay permettre certaine quantité moun a dit dans ces places business ça et puis ces places business là ni pour faire assurer moun ni massan fijayo et moun prend attention pour l'enmeyo dat qui est bien lavé puis si on met rien mettez bagay là ba yo pour yo ça laver et nettoyer la main yo là moun qui dehors business supposé était 6 pieds hod yon a l'autre et monsieur ou ka tan nous ka di et nous ka vie répéter c'est pour yon raison il pas matché à soufidjay personne nous pas savent moun qui ni moun qui pani et pour raison ça sous traiter tout monde comme si de yoni nous n'en plus meilleure chance qu'à combattre ça qu'a passé place business aussi ni pour faire assurer moun pas gain plus passer yo supposé parce que quand ouais écoutez bien ouais avant tout ça commencer moun en ka venir ka gain comme si de c'est payer vers la terre qui a fini yo cadeau ou ni pour acheter là ni c'est bagay là ou ça acheter et quantité ou ça acheter yo ka savent ou supposé acheter quantité ou briser ben ça yo ka permettre yo ka encourager moun qui peut faire l'autre manière qui peut faire sur internet et ça hen délivrer pour faire ça yo ka encourager ça et puis là encore nous ka dou souple place business faire si on nettoyer ces places là chaîne ces places là net parce que nous ka ni moun ka sorti dehors et puis moun ka vini pour faire business en ces places là. Yes, sir.
Thank you, Carlton. Today, I repeat, Monday, 6th April, the general public is asked to remain home. Today is the last day of the 24-hour curfew, the national shutdown. Bakeries are not allowed to open their storefronts, but they can make deliveries today. Supermarkets, food suppliers, other retailers like mini-marts and community small shops and gas stations are busy restocking today to prepare for tomorrow when the nation reopens at 5 a.m. under a reduced curfew. And this curfew will be reduced from 24 hours to 10 hours. Between 5 a.m. and 7 p.m. on Tuesday, Wednesday, Thursday, and Saturday this week, the country will reopen on a scaled-down basis with just essential services being opened. So Friday and Sunday the country will be shut down, observing the holidays, and that is Good Friday and Easter Sunday. And from 7 p.m. on evenings to 5 a.m. this week, a 10-hour curfew will be in effect. Please take note of this. We are due for our first break. When we come back, we have some more news, including the quarantine, the persons who have been discharged from the quarantine facilities. Stay tuned.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection by practicing some basic infection control measures. Taking the stairs, avoid touching the railing. If taking the elevator, ensure you use hand sanitizer immediately after exiting the elevator. Hand sanitizers with 60% or more alcohol are great to use, so have some readily available on your desk for quick use. Have your own personal bottle to carry with you when away from running water and soap. Germs can spread easily and be anywhere. Be sure to wipe down or disinfect desks, telephones, and keyboards. Washing your hands often will reduce the spread of germs, but you must wash them as recommended. Masks and gloves serve a purpose and provide protection when used in the recommended settings and when used correctly. They are not practical for the office or business place and can lead to the further spread of germs when used badly. Use only if you are coughing and/or sneezing or taking care of someone who is ill with flu-like symptoms. For more information, call the Ministry of Health and Wellness at 468-5347, 468-5349, or 468-5350.
Welcome back to our morning program here on GIS at the GIS. This is the national COVID-19 response. We're going over some of the developments, the important updates to provide to you this weekend. The island registering its 14th COVID-19 diagnosis over the weekend. Another batch of persons discharged cleared of coronavirus on the weekend as well. Victoria commences operations as a respiratory hospital today, Monday, and the ongoing 24-hour curfew will be replaced by a 10-hour curfew this week starting tomorrow, Tuesday. If you're just joining us, a special good morning to you, just to provide the most important update, something we need to keep on saying this morning, that today the general public is asked to stay home, remain home. Today is the last day of the 24-hour curfew, the national shutdown. Bakeries are allowed to make deliveries. Supermarkets, food suppliers, other retailers like mini-marts and small community shops and gas stations are busy restocking. You cannot go to these places of business because they are busy restocking today, preparing for tomorrow when the nation reopens at 5 a.m. under a reduced curfew. Between 5 a.m. and 7 p.m. on Tuesday, Wednesday, and Thursday and Saturday this week, the country will reopen on a scaled-down basis with just essential service entities being opened. From 7 p.m. on evenings to 5 a.m. this week, a 10-hour curfew will be in effect. Please take a note. We are soon to hear from some of the distributors. It's quite a busy morning for them. If you experienced Thursday when persons came out to make purchases at the small shops and the mini marts, small shops in the communities and the mini marts, there were long lines, tight queues, persons wanting to get as many supplies, persons who were caught off guard by the Prime Minister's announcement early in the week were trying to get some supplies for their households. So it will be very busy today in terms of restocking these places of business, and we just ask for your patience, and tomorrow you can head out observing the physical distancing protocols. You can head out to get much needed supplies for you and your family. Just to emphasize, if you do not need to head out, please stay in. If you do not need to head out, please stay in. I want to read a press release coming from SLASPA, changes for air and sea cargo operations. As per the issued directives of the government of St. Lucia in relation to its response to COVID-19, the air and seaports and related business remain operational with variations to its procedures. During the imposed 24-hour curfew period from 5 a.m. Wednesday, April 1st, 2020 to 5 a.m. Wednesday, April 8th, 2020, the St. Lucia Air and Seaports Authority, SLASPA, will work with the relevant authorities to ensure the following. Cargo vessel operations will continue as scheduled. Air cargo operations will continue at both airports within the established aerodrome operational hours. Huronor International Airport, 8 a.m. to 6 p.m. daily, and GFL Charles Airport, 10 a.m. to 6 p.m. Monday to Friday. The aerodrome at GFL Charles is closed on Saturday and Sunday. The delivery of both air and sea-related cargo will be limited to the essential services as identified by the National Emergency Management Organization. The authority will extend the free storage period of all cargo at Port Castries and Vieux-Fort to coincide with the duration of the above curfew period. And as we would have been harping this morning, the new curfew period is now reduced by 1 day. So this statement from St. Lucia Air and Seaports Authority is only relevant up to today. Consequently, authorized personnel who will be transacting business at these locations are mandated to adhere to the established social distancing and sanitizing protocol. For more information, please contact the Seaports Department at 728-4775 and Airports Department at 728-4869. And an update that we read on Saturday during our live, the local and regional examinations notice from the Department of Education, Innovation and Gender Relations. The Department of Education, Innovation and Gender Relations wishes to share the following decisions and updates on the local and regional examinations, that is minimum standards tests, the Common Entrance Examination, the Caribbean Secondary Education Certificate, CSEC, and the Caribbean Advanced Proficiency Education, CAPE. Minimum standards tests, grades 2 and 4. These examinations have been cancelled for the year 2020. Minimum standards tests have been cancelled for the year 2020. The school-based assessments, SBAs, prepared by the students will be moderated during the first term of the new academic year 2020-2021 and reports forwarded to the schools. In terms of common entrance examination, this examination will be administered after the Ministry of Health and Wellness deems it safe to do so. Sufficient time will be allowed after that pronouncement to afford students and teachers time to prepare academically and psychologically for the examination. The format of the 2020 exam will comprise solely the multiple choice components. Caribbean Secondary Education Certificate CSEC and the Caribbean Advanced Proficiency Examination CAPE. Discussions are still ongoing with the Caribbean Examinations Council, CXC. Information will be provided when decisions are finalized. A follow-up statement will be made when timelines become more definite. If you have any queries on the aforementioned matters, you should address them to this email, eeau@education.gov.lc. We now want to cue in a news report, an update on the quarantine facilities. We have a report from Fernell Neptune. Take a look.
A total of 139 individuals from the Rodney Bay and Castries public health facilities have completed the 14 days in quarantine and were sent home on Sunday, April 5, 2020. The individuals showed no signs and symptoms of COVID-19 and were provided with certificates of health upon their departure. Chief Medical Officer Dr. Sharon Belmar-George also highlighted the importance of having these individuals in quarantine.
Because there are many countries that are high risk based on the number of positive cases for COVID-19, it's important that we keep persons who come back, travelers, in quarantine where we monitor them, their temperature, we do their vital signs, and we monitor them for respiratory signs and symptoms, that is fever, cough, sneezing, runny nose, sore throat, or just feeling unwell. So we monitor them, and for anyone who develops respiratory signs and symptoms, we ensure that they get tested for COVID-19. This is to protect and to prevent and to reduce the possible transmission of COVID-19 from persons coming into the island.
3 individuals released from quarantine shared their experience.
My experience at quarantine has been, for me, it's been unique. It's been a learning experience. I mean, in the beginning, it was a little difficult until we settled in. After we settled in, it was really comfortable. The nurses, everybody made it really comfortable for us. And we understood what it meant to be quarantined. Because as a seafarer, we work on a cruise ship, most of us, and we got here. We already did a little quarantine on board, but here we did another 14, which was really a good experience before letting out in society. So I'm glad it was done.
I had a good experience in quarantine, but thanks to the Ministry of Health, the Prime Minister, the officers, the nurses, which made it a tremendous experience. So I want to give them a thumbs up and to tell them keep what they're doing, because they're working extra hard to make sure they control the spread of the coronavirus.
My experience here has been pretty positive, I'd like to say. I was able to get a lot of my schoolwork done. We did have a bit of hiccups with the Wi-Fi over the first few days. However, Wi-Fi was always maintained in the front building, so if you did need Wi-Fi, you were able to get it. The food, every day we got 3 meals a day, which was quite nice. I like the rigorous checks that they did for our temperature every single morning and every night. So overall, I think it was a very useful experience.
The individuals in quarantine were provided with care packages from NEMO and transportation to go home. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fernell Neptune.
Thank you for that report, Fernell Neptune. We are just about winding down this morning's live. We do hope that the message was loud and clear and that you understand that you are persons who are not part of essential services, and if you are not working with a distribution company, you should be indoors today. Just want to go over that information that the Prime Minister announced last night, sitting in with CMO, the Chief Medical Officer, Dr. Sharon Belmar-George last night. The public, the general public, is asked to remain home today, Monday, 6th April. Today is the last day of the 24-hour curfew, this national shutdown. Bakeries today can make deliveries, but they're not allowed to open their storefront. Supermarkets, food suppliers, other retailers like mini marts and small community shops and gas stations are busy restocking today, preparing for tomorrow when the nation will reopen at 5 a.m. under a reduced curfew. So we will be moving from a 24-hour curfew to a 10-hour curfew. Between 5 a.m. and 7 p.m. on Tuesday, Wednesday, Thursday, and Saturday this week, the country will reopen on a scaled-down basis with just essential service entities being opened. And from 7 p.m. on evenings to 5 a.m. this week, a 10-hour curfew. This 10-hour curfew will be in effect. As we wrap up, before we wrap up, I just want to read out one more press release. Changes to operations at St. Lucia National Mental Wellness Center due to COVID-19. The management of the St. Lucia National Mental Wellness Center continues to actively monitor the developments related to COVID-19. And to this end, we would like to inform the general public that the outpatient clinic will be postponed for 2 weeks, commencing Wednesday, April 1st, 2020, to Friday, April 10th, 2020. Any patient who is due for an urgent review will be contacted by the staff of the facility. Patients with valid prescriptions which need to be refilled can access the hospital pharmacy on Tuesdays, Wednesdays, and Thursdays. In order to minimize person-to-person contact and to control the potential spread of COVID-19, we will limit the number of persons who can access the pharmacy daily. For further information regarding this appointments, please call the following numbers: 458-5374, 458-5375, 458-5376, or 458-5377. For clinical concerns, you can contact 458-5952. These measures are necessary to ensure the continued safety of the employees and patients at the Mental Wellness Center. The management and staff of the Mental Wellness Center would like to thank the general public for their understanding and cooperation as we work together to control the spread of COVID-19. I now hand over to Carlton to provide a synopsis of this last report that we just had, as well as this press release.
Merci Anchai, moi dit bonjour et merci encore pour vous écouter nous avec nous sur NTN GIS et avec suivre nous sur internet et avec écouter nous l'autre pays et bien sur radio. Non moi c'est Carlton Cyril plus connaître con Cooks. Aujourd'hui lundi le 6 avril nous va continuer ba information avec le développement là venu pour vermine COVID-19 ici à côté GIS NTN et puis à sous radio. Développement qui a pris coup, il y en a ces nouvelles nous qui a sorti Hard Management Authority set ici Solid Waste, là est venu pour Zodi avec service collection Zodi et ben là il a voulu informer public là opération c'est truck là ramassé Zodi qui a commencé jeudi a commencé jeudi le 6 lundi le 6 avril mais paie attention pour manière yo kai fait manière l'année adjustment qui kay point coup c'est qu'on yo pas ka amasser go article kon fridge vieux stove vieux cabinet et puis c'est zodi ça yo doubout amasser ça et yo kay ba information les ça kay fait ça yo ka crier bulky waste trouver qu'on informer solid waste pas ka amasser ces bagages ça pour à présent mais yo vlo savent pour vous qui te ka pli passer yon jour collection en communauté trouver qu'on informer à présent premier jour c'est seul jour yo kay amasser zodou encore pour vous qui te ni pli passer yon jour les trucks zodi a te ka passer amasser zodi en communauté trouver qu'on informer premier jour c'est seul jour yo kay passer pour amasser zodi en communauté là les vini pour Jean Laboui ça c'est mon Lacroix Jean Pakesté te ben Gayabra en Saltibis yo ka fò ou savent qui yo ka ramasser zodi mardi ça c'est demain mardi quoi yo dou ça kay wete kon juste à temps yo hen pli information et puis yo banouy sou ni pièce question voulez demander yo cadeau souple ou peut crier office li moi c'est 453 DD08 encore 443 DD08 ou peut crier office là et puis yo juste ban nous en limo pour WhatsApp qui c'est 7D4 5544 encore 7D4 5544 et ben D85 D76D crier yo et yo cadeau souple et puis yo pas de temps ça qu'a fait Plié formation avec développement, nous ici à Baou, ou kay bien temps nous en l'autre cas, ça c'est 4e cas, là venu pour faire mine COVID-19, et puis ça c'est un jeune madame de l'âge de 56 ans, et puis il contacté 20 000, mais là si moi j'abonne une nouvelle là sur il dit yo jamais entré, il a trouvé quoi traitement, li ensemble avec ces 14 là nous ça si moi a bien dit nous c'est date qui c'est moun ça yo ka hen traitement avec pièce on yo pas une pièce raison pour une pièce moun à sous machine pour à présent et nous ka dit ça c'est un bon bagay aussi yo ja quitté 85 moun qui était quarantine, ça c'est ces gens qui sortent l'autre pays, moun qui était sous cruise ship, moun yo met en quarantine, c'est moun ça ja aller kayo vendredi et quand l'autre 13 aller samedi. Quoi bonne nouvelle tout bonnement nous ka hen lay fini pour ça c'est moun ça yo ha ACC c'est moun ça yo ha examiner yo c'est moun ça pas ka mouche date qui yo ni pièce sin lay fini pour affaire COVID là où si ou te ka ve ou te ka ouais nous ni ou après ça côté en chay c'est moun nan ka dit merci pour traitement yo joine lay yo te en quarantine yon a ces jeunes nom na Isaiah Monrose il dit expérience là c'est yon il partait jamais expériencé il dit bagay était difficile dans le commencement mais les toute bagay fini il était bien confortable et puis là il a dit merci en chay il dit il croit temps te kay pli mais merci bon Dieu yo ha quitté aller qui pas ni pièce complète là l'autre monsieur ou te là sur télévision il dit il était une bonne expérience là et il a dit merci pour ministre santé puis premier ministre là et c'est officier police et nurse expérience là c'est yon qui était bon il voulait dire il a tiré chapeau à ces mounsa parce que yo ka fait un bon travail et puis ces mounsa ka contrôler manière vermine COVID-19 ka si manger. Encore nous voulons savoir les vini pour aujourd'hui lundi le 6 avril ou supposé être caillou autant annoncement premier ministre et puis accompagné par 6 mois moun supposé être caillou jordia celle sept moun qui supposé d'avoir jordia c'est Jean Bakery et c'est moun ça qui fait délivrer et ay 20 payo ou pas supposé ouvert pour moun entrer et combler ensemble encore c'est ça yo ka empêché parce que ça c'est une ces manière 20 000 ka trouver quoi transmettre qu'on a trouvé quoi informer pays a fermé toujours celle sept moun qui supposé d'avoir là c'est Jean Bakery et puis c'est gens supermarket, gens qui ni boutique, toutes ces moun ça qui mettent marchandises et articles dans place business yo parce que pays a trouvé quoi ouvert demain mais et puis conditions, ces conditions c'est vini mardi, mercredi, jeudi, samedi ou kay ça vendredi et puis dimanche ça c'est vendredi saint et puis Pâques c'est un holiday qu'on a trouvé quoi informé depuis demain, aller mardi, mercredi et jeudi, ou kay trouvé quoi ni pour dedans par 7 heures au soir. Et ou ça sorti par 5 heures bon matin. Quand à présent, commencer demain, moun kay trouvé quoi yo permetté pour ay faire affaires yo. Mais ou kay sort dehors à 5 heures bon matin. Pour 7 heures au soir. Depuis autant il 7 heures, on est pour trouver quoi en dedans parce que nous trouver quoi nous en bas curfew a toujours pas 24 heures de temps mais 10 heures de temps. En soulagement, anti-soulagement pour monde gain ça yo brisé et à même les yo cadeau les fini pour ça. Changer messieurs des moun pas famille si posé en dedans en machine si ou kay servi machine pour aller faire ça ou brisé gain ti commission avec bagay des moun pas famille police kay là pour faire assurer ou payer attention pour ça ka aller et yo kay ve ça ou ka fait là les supermarkets et place business ouvert yo vlo changer aussi ou si poser chaîne distance 6 pieds, c'est ça ici posé, wete si pied. Sou ka lan public en parmi moun, yo ka encourage pour mettre masse en fidjayou, l'anman ou koto touché, souple, nettoyer l'anman et continuer ka faire ça, kon jounen ka aller. Changer ça. En pile de nous, pas ka kopan, pas ka tan. Yo ka mando souple. Sou a sou ligne nan, fait asiwe moun nan ki bo lan, wete si pied, rodo. L'autre bagay place business yo ka mande yo pour faire. Moun supposé ni mas le kanton business lan mais yo supposé nettoyer, yo supposé ba ou se bagay se benign, dehors aussi yo supposé mettre dehors côté ou supposé du bout ou supposé du bout si pied hod yon à l'autre. Yo pas kay permis pour point plus passer ces bagay là ou ça gain changer encore moun anik te ka gain tout ça yo hen comme si di bagay ka fini yo ka do la ni différents marchandises ou pas ça point plus passer deux ou pas ça point plus passer en caisse mettez ça en lido avec chance en lido pas du temps ou kay trouver ko do wala. Nous ka encourager moun ki sa gain bagay sur internet et puis do wa faire ça avec ou ça hen moun deliver ou ba fait. Yo ka do aussi les vini pour nettoyer place business, Jean business yo ka encourager pour faire ça. Encore nous ka ini 10 année de temps curfew commencer demain. C'était ou supposé trouver corps en dedans pour 5 heures bon matin. Trouver corps informé. Pièce wom pa kay van pièce côté. Pièce wom moi répéter pa kay van pièce côté. Encore yo ka fait ça parce que nous ka essayer contrôler vermine COVID-19 quoi pièce wom ni en supermarket restaurant pièce côté pas supposé ni wom ka van yo pa vle moun combler ensemble yo pa vle moun venir ensemble pour yon raison et ban l'autre ek. Quand on kay fait ça chen en lido ou supposé ou était hod yon à l'autre. Souple messieurs, commission bien claire ici et nous ka ba ou toute information qu'on nous ni mais encore commission c'est ou était hod yon à l'autre. Traiter chaque moun ou hen comme si di we yoni vermina. Information bien claire. Ou était si pied hod yon à l'autre. Messieurs dames, nous pas à dire plus passer ça encore nous encourage avec nous cadeau qu'on nous joindre ici ou était sauve ou était caillou ou était femme ou changer là là pour toute précaution parce que vers maintenant nous inspire c'est toujours merci Dieu grâce à papa nous pour connaître personne qui mort quoi en chaîne ni kon zoé pas ka hopé tête moi dit encore ou était hodion à l'autre mettez en pratique tout ça nous jadia avec moi ka creux avec moi ka siwe si Dieu veut nous kay combattre vermine COVID-19 zae merci Anchai ensemble puis Jessie sia moi ka dit Dédé.
Thank you, Carlton, for that synopsis. Well, that wraps up the updates that we have for this morning in terms of St. Lucia's COVID-19 response. The 24-hour shutdown will be reduced from 24-hour curfew to a 10-hour curfew, as mentioned numerous times in our broadcast this morning. We will be back at 10 a.m. Later on today, the Prime Minister is expected to make a pronouncement on the zoning system that will be put in place. So that is something that you can expect. We had a lot of persons querying that. So the Prime Minister, the Honorable Alan Chasney, will be speaking on that. Do stay tuned. We will be back at 10 a.m. We hope to speak to the wholesalers, touch base with wholesalers, and open the phone line so that you could call in and tell us your experience, your feelings with regard to this upcoming week. And in the meantime, we want you to remain indoors. Today is the final day of the 24-hour shutdown, the 24-hour curfew, and tomorrow we will begin with the reduced curfew of the 10 hours. Do stay indoors and stay tuned. If you have not yet done so, please like our Facebook page, Government of St. Lucia. You will get important updates throughout the day, and you will always know when we go live. You can always know when we have new content by just clicking the like button to get our notifications. My name is Jessie Leonce. In studio with me, Carlton Cyril, better known as Cox. We will be back later on this morning to provide you with more information. Stay tuned.